Hi everyone, my name's Kathleen and I work with IC Outreach. At IC Outreach, our mission is to empower and enhance the lives of seniors through improved interpersonal communication. According to the World Health Organization, over 15% of adults over the age of 60 suffer from a mental disorder. A common mental disorder among seniors is depression, occurring in 7% of the elderly population. Unfortunately, this mental disorder is often underdiagnosed and undertreated. Older adults account for over 18% of suicide deaths in the United States. Because depression can be a side effect of chronic health conditions, managing those conditions help. Additionally, promoting a lifestyle of healthy living, such as betterment of living conditions and social support from family, friends, or support groups can help treat depression.
It's the feeling of being cut off and not having the access or the means to connect again with other people. You can see it, it's there, and I think the worst part of it, there's a world outside, but you cannot easily tap in or join in because of the restrictions you've got.
Used to be with all the family years ago. They've all died off one after the other. Then I've got friendly with these two ladies and they've died. So, I mean, there's so many people have died. I've got cousins, but they don't keep in touch. But one, the phone sometimes, but I don't, I haven't, let's put it this way. There isn't anybody that I could call my next of kin.
Here are additional statistics based on seniors living in Canada. Statistics show that for the first time, Canadian seniors outnumber children. The average life expectancy has gone up, leading to more seniors living alone. As seniors age, their communication may be impacted by other variables, including vision, hearing, and cognitive changes. Fast-paced technology and increased use of social media, websites, to disseminate information means a significant portion of seniors may be left behind or excluded. Even though we are currently in a worldwide pandemic, loneliness is an epidemic that affects millions of people over the age of 45. This level of loneliness also exists among immigrant seniors. The main issue that affects immigrant seniors is language barriers. After going through all the difficulties that seniors are going throughout our community, let's look at some of the good news. More seniors are working, volunteering, and participating in social activities compared to years past. The vast majority of Canadian seniors live in the community and no longer in long-term care facilities. The Government of Canada has created programs and policies targeting healthy and active aging, enabling active participation in the labor force and the community, ensuring seniors have access to information, services, and benefits, and helping seniors to age in place. For our We Connect initiative, we will be implementing a 5-year program which will be split up into 3 stages. For the first stage, we will conduct surveys to determine the baseline data and identify the needs and target areas of enrollment. The second stage will include soft introduction of programs and outreach education to seniors to educate them on program benefits and enroll participants. The third stage will involve the check-in to assess measurable outcomes, identify barriers and problems, and modify any programs as needed. To assess the impact of our program, we will conduct surveys in year 1 and again in year 5. At the end of 5 years, we expect to see an increase in the percentage of participation in our program, an increase in the percentage participation in other community and government programs, more seniors using technology, indicating improved knowledge, confidence, comfort with virtual communication and platforms, and an improved or maintained health overall. Our program is unique in that it aims to improve interpersonal communication using a multimodal approach, which is over the phone, in-person visits, and with technology. It's also distinctive in that we recognize and incorporate the cultural diversity of the communities, utilize cultural intelligence strategies in our programs, and promote cultural competence in our organization. Improved interpersonal communication will enhance the lives of seniors by combating loneliness and the resulting health impacts, increase access to government and other programs, and improving overall quality of life. The first program that we will be rolling out during the COVID-19 restrictions is Phone Pals. Phone Pal volunteers will provide regular daily or weekly telephone calls to isolated older adults who have few connections to family members or friends. Calls can be made in the comfort of our volunteers' own homes. Volunteers often become a telephone friend, which is a resource or confidant to the client. And both parties will be trained in interpersonal communication strategies to enhance relationship building. After COVID restrictions are lifted, the next program that we will be rolling out is Friendly Visiting. Clients and volunteers are matched with someone of similar interest and location. Volunteers will provide socially isolated older adults with opportunities to socialize and develop new friendships. These programs may consist of social activities such as going for walks, friendly check-ins, chatting, or getting a cup of coffee. Again, both parties will be trained in IC strategies to enhance relationship building. Our third program that we will be rolling out is the Technology Workshops. This program teaches seniors how to become more tech-savvy and be able to communicate through email. This program will help seniors set up and use social media to be able to keep in touch with family and friends. Our volunteers will also provide ongoing support to help seniors complete online forms, applications, virtual bookings, or other personal needs. As part of our training program for volunteers and staff working with older adults, they will be responsible for attending mandatory training on how to effectively communicate with seniors. As part of our program, volunteers will learn to 1. Exercise patience and compassion. It goes without saying that patience and compassion are often needed when working with older adults. 2. Communicate clearly. Clear communication skills are vital when communicating. We stress the need to speak clearly using appropriate volume and rate of speech. Good communication depends on good listening. A good tip is to stick to one topic at a time to avoid confusion, and we emphasize our volunteers to try to not get irritated or frustrated if they have to repeat something several times. And 3, respect differences. Generations can create differences in opinions, views, and general outlooks on life. An attitude of respect and tolerance. A sizable population of seniors face an added challenge in the form of language barriers. Adapting is not always easy for immigrants, especially if they are the aging demographic. If they are unable to learn a new language quickly, seniors can become isolated from their community, leading to loneliness and even depression. According to a Government of Canada report, social isolation is higher for seniors who are newcomers to Canada. As part of our program, we will be conducting a study on how we can address the issue of language barriers and provide the need for linguistically appropriate services. To help seniors feel connected and valued, our program will connect seniors living on their own or in residential facilities with volunteers who can speak their native language to help seniors find meaningful social connections. Because of complex and chronic nature of many communication disorders experienced by older adults, intervention efforts must include strategies to reduce overall disability. Research suggests that training communication partners such as nurses, family members, and volunteers in residential facilities can bring about more positive communication. These strategies may involve manipulating the environment and decreasing background noise, distractions, and distance between speakers. Other suggestions for communicating with older adults with communication disabilities are knowing the patient's communication strengths and weaknesses, taking time for extra communication, make sure the environment is communication friendly, for example, quiet, well-lit, face-to-face interaction, and using living room language, not medical terminology. At IC Outreach, we are very excited to roll out this new initiative called We Connect. I thank you everyone for joining me today and listening, and if you have any questions, feel free to speak to any members of our team and they'll be able to answer all your questions.